Download the Nursing Lecture app and get access to the premium videos, articles, mnemonics, practice test series and chat completely free. Get it from the Play Store. Hello everyone. In this lecture, I am going to take a topic that is Partograph, in which I will be going to discuss. So, Partograph is also known as Partogram or cervicograph, and this is a very important parameter for measuring the maternal and fetal outcome in a single sheet of a paper. So, that is why it is called the graphical recording or the partogram. And let us talk about what is the history behind this. So, partograph is initially introduced or devised by Emanuel Friedman. Emanuel Friedman introduced this partograph in 1954, and later on in this partograph, two important events are also added that we will talk about later. So, firstly we will see W.H.O, that is World Health Organization, gives three type of versions in partograph, and first we will talk about the first version, that is called the composite partograph. So, let me show you the image. What is composite partograph? So, here is the composite partograph in which various parameters we are measuring simultaneously, that is the fetal heart rate, cervical dilatation, descent of head, contractions during 10-minute period of time, and the drugs which we are giving to the woman and the maternal outcomes. So, the basic difference between the composite and the other version is that we will see here in the cervical dilatation. Initially, Emanuel Friedman given that there are the two phases in cervical dilatation. As you already know that cervical dilatation starts from 0 and it ends with the full dilatation, that it means 10 centimeter of dilatation. So, latent phase starts from the 0 centimeter and it ends with the 3 centimeter dilatation. So, here in this figure you can see this latent phase, that is from this 0 to 3 centimeter dilatation, it takes almost 8 hours. Here you can see these are the hours. So, for the primigravida woman, it means the woman who is pregnant for the first time, this latent phase takes at least 8 hours, and in multigravid it takes 4 hours only. So, according to this latent phase, that is from 0 to 3 centimeter, it takes 8 hours to complete. Okay. Now, the another phase, that is called the active phase, this active phase commences at 3 centimeter dilatation. So, from 3 centimeter dilatation, and when it reaches up till the 10 centimeter dilatation, it takes another 7 hours. How? The rate of dilatation in active phase is about 1 centimeter per hour. So, by this you can calculate. Suppose here it is the 3 centimeter dilatation, and for completing the 4 centimeter dilatation, it takes almost 1 hour. So, this is how you can count 1, 2, 3, 4, 5, 6 and 7. So, after the completion of 7 hours, the woman may have full dilatation. Okay. So, according to Friedman, what is given in the cervical dilatation is that there are two phases. One is latent phase, that is from 0 to 3 centimeter dilatation, and it takes 8 hours to complete, and from 3 centimeter to 10 centimeter in active phase, the rate of dilatation is about 1 centimeter per hour. Okay. So, this is how we calculate. So, this was given by Emanuel Friedman, and along with that in 1972 two another persons, that is Philpott and Castle. Philpott and Castle also introduces two another lines. They introduces two lines. What are the lines? Here you can see there is one alert line and the another one is action line. So, what is alert line? So, according to this alert line, usually what is happening? The rate of cervical dilatation is the same, that is 1 centimeter per hour. So, this alert line begins at the 3 centimeter dilatation, and by the 1 centimeter per hour dilatation, the plotting will be on alert line. So, this is how the alert line is plotted, and the another one is the action line. So, action line goes 4 hours apart and parallel to alert line. So, these two lines, alert and action line, were given by the Philpott and Castle, and the descent of head is also given by Philpott and Castle. So, in this composite type of partograph, what two things are included in this? That is, one is latent phase, that is from 0 to 3 centimeter dilatation, and the another one is the dilatation which begins from 3 centimeter and it reaches up till 10 centimeter, comes into the active phase. Okay. So, it was given by Emanuel Friedman. So, he told that there are the 3 phases, that is in active phase. One is the acceleration phase. So, this acceleration phase begins at 3 centimeter and it ends with the 4 centimeter. So, that is called the phase of acceleration. So, you can compare this latent phase with the acceleration phase. So, in a latent phase, the rate of dilatation becomes slow, and once it reaches about 3 centimeter, there is sudden rise in the cervical dilatation. So, that is called the phase of acceleration. Then comes the phase of maximum slope. The phase of maximum slope, in which the rate cervical dilatation becomes from 4 to 9 centimeter, and it goes like this, okay, sudden jump. And third phase which he was given is that the phase of deceleration. The phase of deceleration. So, phase of deceleration begins at 9 centimeter and ends at 10 centimeter. So, after reaching 9 centimeter, the slopes goes slowly like this. Okay. So, as these phases were introduced, what is seeing in this graphical recording, that S shape is forming. In the active phase, what is forming? S shape, and that is called the sigmoid curve. So, this was about the composite partograph, and W.H.O recommended the another version in this partograph, that was called as modified partograph in 2000. So, let me show you the another image. So, here is the another version of partograph, that is called the modified partograph. So, I will show you that what all things we are measuring in this partograph. Firstly, the identification data. So, in the identification data, we are measuring here the name of the mother and the gravida state, that is the pregnancy state of the woman, past as well as the present, and the para, that is the pregnancy state of a woman which crosses the viability period, as well as the hospital number, then date of admission, time of admission, and when the membrane become ruptured. So, all these comes into the identification data. Next thing which we are measuring here is that the fetal outcome, and in fetal outcome there is FHR, what is fetal heart rate. So, fetal heart rate could be measured, and in this fetal heart rate, the baseline is, you all know that the baseline of fetal heart rate is about 110 to 160 beats per minute. So, how we can plot here? We can plot here by a dot. So, suppose if we get 120 or 130 beats per minute, or again 120, or again it goes to 130 as well as 140. So, likewise we are measuring by a dot, and then we will join all these dots by a straight line. So, this is how we will record the fetal heart rate. So, fetal heart rate is the important parameter to check out the fetal outcome during first stage of labor, and we are measuring here within 30 minutes, that is we are recording here 30 minutes in a 30 minute, but it does not mean that we are taking in 30-minute duration. We need to take it frequently, or if a woman is high risk condition, is in a high risk condition, in that condition we need to take within 50-minute periods. Okay. So, we are measuring here in the 30-minute duration. So, here the boxes which you are seeing here, these all indicative of 30-minute duration. So we are recording within 30-minute duration. So regarding the liquor amni, what we are recorded here is that during first stage of labor, the membrane doesn't rupture, they remain intact. So if we are assessing per vaginally, and at that time if membrane become intact, they doesn't rupture, in that condition we need to write I. And if membrane become rupture, we need to write R. And if they become rupture and amniotic fluid is completely absent, in that condition we need to write A, that is absent. And if amniotic fluid become contaminated or mix up with the first stool of the fetus, that is called Meconium, in that condition we need to write M. And if it is contaminated with the blood, if there is premature separation of placenta, in that condition we need to write B, that is blood stain. So this is how we need to write liquor amni: intact, rupture, absent, meconium stain as well as the blood stain. Now next comes the molding. So what is molding? Molding is a phenomena in which, as the fetal skull is the most difficult part to come out through the bony pelvis, so when the fetal skull comes down and descend down through the bony pelvis, what is happening? The fetal head become compressed, and when it become compressed, the bone may overlap to each other or may come closer or they do not. So we are just assessing how much these bones come closer by this molding process. So let me show the image so you can understand how we can write it here, how much molding is there or not. So here in this image you can see in the first figure, the bones are not overlapping to each other, or even though you can feel the suture line because there is a gap in between the bones. So if you feel like that during per vaginal examination, in that condition you can write 0. So it means the molding is 0 and the head doesn't compressed. Now the next image indicative of +1 molding, in which the suture lines become more narrower because the bones become more closer to each other. Okay, so bones are closing to each other, they just touch to each other but they do not overlap. So it is +1, and when the molding become +2, that is +2 means the bones become more compressed, and in that condition the sutures completely disappear and the bone become overlap to each other. But in +2 condition, when you do per vaginal examination and you try to separate these bones, then it can be separable. So that is called the +2 molding. And the last figure you can see here, in the last, that is the +3. So what is +3 molding? In that condition the fetal head become more compressed. So at that time the suture completely disappears, as well as the bones which are lying to nearby each other, they become overlapped tightly, and once you do per vaginal examination and try to separate these bones from each other, they do not. So they are not separating from each other, they become tightly overlap over each other. So if you feel like that, in that condition you can need to write +3 molding. So what you can write it here, 0 if there is no overlapping and you can feel suture, +1 that if the bones come closer but not overlapping, +2 if the suture completely disappears and the bone become overlap to each other, and +3 that the bones are so much overlapping that after doing per vaginal examination and by compression the bones are not separable. So this is how molding could be written. Now comes the very important feature in this partograph, and that is the cervical dilatation. And you can see here there is a slight difference in between the composite as well as this modified one. So in this modified figure you can see here there is no latent phase. So one thing which change into this modified partograph is that the latent phase is completely removed. Okay, so there is no latent phase and the active phase begin at 4 cm dilatation. Just recall that we have seen in the composite type of partograph that the active phase begins at 3 cm, but here you can see this active phase begins at 4 cm. This is the basic difference, and the remaining, the alert line and the action line were the same, and the dilatation rate is also same, that is 1 centimeter per hour. So if a woman came at 11 a.m. and at that time if she is having 4 centimeter dilatation, it means the woman is in active phase. So we point here the X, and at 12 p.m. if her cervical dilatation become at 5 centimeter, then we can measure here again X, and then we can join these two axes together by a straight line. So this is how we plot cervical dilatation. So here also the cervical dilatation rate is same in once a woman goes into active phase, that is 1 centimeter per hour. So in a normal condition, that it is this graphical recording is very important, because we just need to know that how much this labor progress is deviating from the normal condition. Okay. So in a normal circumstances, once we measure all this plotting, and if it comes on the alert line or left to the alert line, then it is showing that the labor is progressing toward the normal. But if we are plotting and the line goes in between the alert and action line, in that condition, if a woman in a primary center, then the woman need to be referred to a specialized hospital. And if this line, this plotting goes on the action line or beyond to the action line or right side to the action line, and in this danger condition, the skill observation should be monitor the condition of a woman very carefully, because at that time woman needs some action to complete the labor process. So action could be taken by a skilled person depending on the condition, whether it is the latent, prolonged latent phase, or whether it is to be protracted phase, or maybe it is the arrested phase. So depending on the labor condition, the person need to be take appropriate action. It could be amniotomy, that is the artificial rupturing of the fetal membrane, or it could be the oxytocin infusion, or it could be cesarean section. Depending on the condition, the obstetrician need to be take action. Okay. So this is how the remaining things are the same, that is the this is the active phase, and in active phase there is an alert line, and in a normal condition the plotting should be on the alert line or left to the alert, that it means this side. Okay. And once it comes in between the alert and action line, then the woman need to be referred immediately to a highly specialized center. And if it goes beyond to the action line or right to the action line, in that condition immediate action could be needed for a woman to complete the labor process. Okay. So this is how the cervical dilatation is recorded in the partograph. Now next comes the descent of head. So descent means the head to become down the pelvic cavity, brim as well as the cavity. So how much it is descending, we are measuring here by O. Okay. So we are plotting here by O. So suppose here it is the head of the fetus, in that condition we measure here the O, and in next if we are getting here at this point, if we are getting here at this point, so likewise we are measuring here by O, and then finally again in this also we just join these all lines. So how we can measure this descent of head? We are not measuring this descent by pervaginal examination, but we are measuring by abdominal palpation by a finger method. So how? I am just showing you an image. So by the abdominal method or the abdominal palpation method, you can monitor the descent of head. So in this first image you can see here how we are measuring. We are just putting our hand on the symphysis pubis, just above the symphysis pubis of a female or a mother. If we are feeling the head of the fetus 5 finger above the pelvic brim, in that condition, like in this image you can see the head is feeling 5 finger above from the pelvic brim. So if we are getting this thing, then we'll record it 5. Okay, because we are 5 finger, we are feeling 5 finger of fetal head. Once the fetal head become descend down and it goes into the pelvic cavity, like in figure 2nd you can see here, and at the time if we palpate the fetal head, we are just getting the 2 fingers. So, in this second image you can see only 2 fingers are there to palpate the fetal head. So, this is how. Let me show you the another image. Okay, in this also you can see here in this image that what is 5, 4, 3, 2, 1 and 0. So, we are measuring in a partograph from 5 to 0. So, what does 5 mean? That is, this is the pelvic brim, and so this is the pelvic brim, and we can feel 5 finger above the pelvic brim the complete head. Okay. So, in that condition we need to write 5. If we are just getting 4 finger above the pelvic brim, then we can need to write 4. Okay. So, likewise 3, 2, 1 and 0 means when the head completely descends down and it goes into the pelvic cavity, we are not palpating the fetal head just above the pelvic brim. In that condition we will write it here the 0. Okay. So, this is how we will plot the cervical dilatation as well as the descent of head. Now, so here you can see the large boxes which are showing here, these all are denoting 1 hour duration, and the small boxes here indicative of 30 minutes of duration. So, small boxes means the recording could be measured in a 30-minute duration, and large one it means you need to record during at an interval of 1 hour duration. Now, the another important thing which we need to write it down is the contraction. So, here you can see. So, there are the 5 boxes 1, 2, 3, 4, 5, and first it means the one box means there is one contraction. Okay. So, there are 3 types of contraction. One is the mild contraction, and once you feel the mild contraction you need to plot in a dotted manner, okay, like this. So, what is mild contraction? Once you place your hand on a woman's abdomen, you feel the hardening of the uterus, that is the uterine contraction. So, this hardening persists for how many duration? How much duration? So, if it is persist for about 20 second duration, then it will be called as mild contraction. And if you feel the moderate type, it means the contraction or the hardness persists for about 20 to 40 seconds. In that condition, you can write it here moderate type of contraction. For the moderate contraction, you need to draw a slant line. So, by this slanting line, you can indicate the woman is having moderate contraction. And if you are palpating and you feel that woman's uterus become hard more than for about 40 to 45 seconds, in that condition the contraction become severe type. So, how you can monitor here the severe contraction? You can just dark the box. So, the dark box indicative of the severe contraction, like this. Okay. So, this is how you need to measure the mild, moderate and severe contraction. So, mild contraction lasts for less than 20 seconds, moderate lasts for 20 to 40 seconds, and the severe one lasts for 40 to 45 seconds or more than that. Okay. So, ideally there will be a one contraction in 15 to 30 minute duration in early first stage of labor, which lasts for about mild to moderate. That could be a 20 to 30 second of duration, but later on, once this first stage going to be end or it is mid of the first stage of labor, at that time the duration should be the regular interval should be 3 to 5 minutes of duration, and it comes for about 45 seconds. So, in the late stage the contraction become more severe and it comes in a shorter interval, and that initially it comes in a 15 to 30 minute duration, and later on it comes within 3 to 5 minutes. Okay. So, this is how you need to palpate as well as write it down the mild, moderate and severe type of contraction. So, the next comes in this partograph is the oxytocin. So, in the oxytocin infusion, firstly in the first box you can write it here the units, how much you are infusing, and drops per minute in next box, that in RL you are mixing this units and at what drop factor you are just infusing in per minute. So, suppose you are giving 60 drops per minute, then you need to write here 60 drop per minute. likewise. And apart from the oxytocin, if you are administering any other drugs like antibiotic or any other sedatives, or you are infusing any other IV fluids, so you can write in detail here which drug is there, how much doses, and at how much interval you are giving the drugs to the mother. Now next comes the maternal parameters. So here is the pulse. So the pulse you need to be write here by a dot likewise, and you need to be record in every 30 minutes, same as an FHR, and then you need to connect all these dots by a straight line. So pulse rate is recorded in every 30 minutes by a dot, and just join these dots by a single straight line. Then next, blood pressure. So blood pressure to be recorded at 4-hour interval by a vertical line and by drawing arrows both sides. So in a 4-hour interval you need to write the blood pressure of a woman. So this is how you can mention the blood pressure. Or if a woman is hypertensive, in that condition you need to write 1 hourly. And the temperature recording also you can done 2 hourly, or you can perform it by 4 hourly duration. So here you can write down the temperature of a woman. And the last comes the urine output. So it is also the one of the important parameter. So here you need to write the how much at what interval women become voided and what is the volume of the urine. And here you also need to write the acetone which is excreted or the protein excreted through the urine. So it is very important parameter in a hypertensive as well as a diabetic woman. So you need to write the amount acetone as well as the protein. So here we have seen the another type of partograph, that is the modified partograph, and this was introduced by W.H.O in 2000. So it is slightly different from the composite type, and which I have already mentioned here, that in this modified one the latent phase is completely absent and the alert line begins at the 4 cm dilatation, and remaining all features are same as in composite Partograph. Later on in 2006, W.H.O given the third version of Partograph. So let me show you the image. So in this you can see here it is color coded. So if this also begins at 4 cm dilatation, that is the active phase, and the rate of dilatation is same as we have seen in the modified as well as the composite Partograph. But here you can see in this color coded figure that there is a green color if you are plotting and by the x, and if it comes on the green side then it is considered that is the labor is in a normal progress. But if you are plotting goes in this amber color, so this indicative of that you need to close vigilant your mother, because there may be any risk to the mother in a progress of labor. And once your plotting goes beyond to this amber and goes into the pinkish or reddish colored zone, that you need to take action, as we have seen. This is the alert line and this is the action line and this is the zone in between two. So the marking is same as we have seen in the other two version, but here you can see the descent of head is not mentioned here. So in this simplified, as this name suggests, simplified means it is very user friendly and simple to use. So in this simplified Partograph you just need to plot cervical dilatation in a simple manner, and here on this vertical axis there are the cervical dilatation, and in this axis there are the time in hours. Other than that there are the other parameters you can see here, that you can mention early that at what time the membrane become ruptured, rapid assessment, vaginal bleeding is there or not, amniotic fluid becomes stained or not, or it is clear, contraction, how much contractions are coming in 10 minutes. Effectively it is considered that in a late first stage of labor there should be a 3 contraction in a 10-minute duration. Now fetal heart rate, how much fetal heart rate is there, whether woman is voided or not, what about her temperature, pulse, blood pressure, cervical dilatation rate, or if placenta is delivered then what will be the timing of the delivery of the placenta, and if you have given the oxytocin, then how much doses is there and how much infused or drop per factor. So, or any other problems. So, you can just write it here in this simplified partograph. So, this is the third version of the partograph, that is called the simplified partograph. So, here in this lecture we have seen the three types of partograph, that is the composite partograph. Here it is. So, this one is the composite partograph. This is the modified partograph, which we are usually practicing in the specialized hospital, and the simplified partograph, and this one is we are generally used in the primary health center. So, this partograph or the graphical recording on a single sheet of a paper is a very important thing to see the woman in a first stage of labor, that how much labor is going in a normal process or not, or how much it is deviating from the normal. So, we can take an appropriate or immediate intervention. I hope this will be helpful for you. Thank you.